Fentanyl has become one of the deadliest drugs in the United States. And if you or someone you love is struggling with fentanyl dependence, one of the first questions you're probably asking is, how long does it actually take to detox? That's exactly what we're going to cover today. Before we get started, if you need help finding a fentanyl detox program near you, call 800-671-4304. Specialists are available right now to help you find the right treatment. Let's start with why fentanyl is so dangerous. Fentanyl is a Schedule II opioid, legally prescribed by doctors to treat severe pain, but it's also sold illegally on the streets and purchased online. It is up to 50 times stronger than heroin, and up to 100 times stronger than morphine. Just 2 milligrams, an amount you can barely see, is enough to trigger a fatal overdose. And the problem is growing. The number of fentanyl-related deaths in the U.S. tripled between 2013 and 2015. Illicit fentanyl seizures by law enforcement grew by more than 1,700% between 2017 and 2023. And because fentanyl is cheap to produce, many dealers are cutting heroin and cocaine with it, meaning people are dying from fentanyl overdoses without even knowing they took it. So what happens when someone tries to stop? Quitting fentanyl abruptly, cold turkey, is not only painful, it can be dangerous. Stopping suddenly increases the risk of severe withdrawal, relapse, and overdose, especially if someone quits for a period of time and then returns to the same high doses their body can no longer handle. That's why professional detox treatment is so important. There are 3 main methods used to detox from fentanyl. The first is tapering detox. With tapering, doses are gradually reduced over time, giving the body a chance to adjust without triggering severe withdrawal symptoms. This process is carefully monitored by doctors and can take anywhere from weeks to months, depending on the severity of dependence. Some patients using this method are even able to continue working and managing daily responsibilities during treatment. Common medications used in tapering include morphine, methadone, and buprenorphine, all FDA approved for treating fentanyl dependence. The second method is rapid detox. Rapid detox is an accelerated approach that typically lasts 2 to 3 days. The patient is placed under general anesthesia while medications speed up the withdrawal process, allowing the body to go through withdrawal while the patient is in a medically induced coma. The procedure itself takes 4 to 8 hours, but patients typically spend 2 to 3 days in recovery under close medical supervision. This method is generally recommended for people in good overall health who can withstand the intensity of a shortened withdrawal period. The third method is medical detox. Medical detox takes place in an inpatient or hospital setting and uses medications to treat or eliminate withdrawal symptoms. Medications like methadone, buprenorphine, and naltrexone are commonly used. An intensive medical detox typically lasts between 3 and 5 days. So how long does fentanyl detox actually take? The honest answer is, it depends. Detox can last as little as 3 days or as long as several months. The timeline is shaped by factors like which detox method is used, how long and how heavily someone has been using, whether other substances are involved, and whether there are co-occurring mental health conditions that also need treatment. Here's a general withdrawal timeline for medical detox. Days 1 through 3. Mild symptoms often begin within 6 hours of the last dose. These include sweating, runny nose, muscle aches, insomnia, agitation, and anxiety. Days 3 through 5. Symptoms peak and are at their most severe. In addition to worsened mild symptoms, patients may experience abdominal cramping, diarrhea, nausea, vomiting, muscle and bone pain, and intensified psychological symptoms like irritability, anxiety, and depression. Days 5 through 14. Physical symptoms usually begin clearing around day 5, though this varies by individual. Some patients continue experiencing cravings, insomnia, and irritability for months after detox, but these can be managed with continuing care. Here is a full list of common fentanyl withdrawal symptoms: joint and muscle pain, back pain, chills, goosebumps, nausea, vomiting, rapid heart rate, rapid breathing, sweating, coughing, loss of appetite, weight loss, tearing of the eyes, runny nose, abdominal cramping, diarrhea, fatigue, insomnia, excessive yawning, cognitive problems, irritability, anxiety, depression, and cravings for fentanyl and other opioids. While fentanyl withdrawal is rarely fatal on its own, certain symptoms, like vomiting, diarrhea, and severe depression, can lead to serious complications if not managed properly. This is why detoxing at home, without medical supervision, is strongly discouraged. Some people who have been dependent on fentanyl for a long time may also experience something called post-acute withdrawal syndrome, or PAWS. This is when psychological symptoms like depression and suicidal ideation are intensified and prolonged due to long-term opioid use. In some cases, PAWS can last for years after completing treatment, making ongoing therapy and support essential for staying drug-free. Now, detox is just the first step. Once the physical dependence is addressed, additional treatment is needed to tackle the psychological roots of addiction. Most detox centers offer continuing care that includes cognitive behavioral therapy, which helps patients identify the thoughts and behaviors driving their addiction and develop healthier ways to cope. Individual, group, and family counseling. 12-step support groups like Narcotics Anonymous, and other therapies like art therapy, exercise therapy, and music therapy, all of which have shown effectiveness in supporting long-term recovery. Recovery from fentanyl addiction is possible, and the first step is finding the right detox program. If you or someone you love is struggling with fentanyl dependence, call 800-671-4304 right now. Specialists are standing by to help you find a licensed detox center near you. You don't have to face this alone, and you don't have to wait. Call now.